asking you, why did you become a naturopathic doctor?
Hi, Tanya. Thank you. I was always interested in health as a child. I was always interested in healthy eating and taking vitamins and exercising. I always wanted to be as healthy as I could. I ran track and field in university on the university team. I studied medical sciences at University of Toronto. I was in this mode where I knew I wanted to do something in medicine. And then I got sick in my third year university we don't know what it was, but I had irritable bowel syndrome. The doctor just said it's irritable bowel syndrome. They didn't do any tests, nothing. They just gave me a pill and said, take this, and it didn't really help. And I had fatigue, and then I suddenly became sick all the time. I couldn't run track and field anymore in my third year. I had to stop doing that. I could get through school, but there was something wrong. And I wasn't brought up with naturopathic medicine, so I Googled it myself and found, oh, what's a naturopathic doctor? This sounds like the kind of doctor I want to be. So I want to go see one to see what they do, because I wasn't getting any help from Western medicine for my problems. So I went to see a naturopathic doctor, and I really, really was impressed with his approach because I felt comfortable. He spent a long time talking to me, about an hour, and I even mentioned things that I wasn't going to him for. So he pulled things out of me that I didn't even realize were related to my health. And he gave me some really good suggestions and things at the time that helped. And what really stuck with me was his approach. I liked that it was a calm environment, and I just felt a lot more comfortable there than when I was speaking to my Western doctor about my problems, especially since I had that time to express myself. So I decided then and there, I looked into it, I researched it, it just resonated with me that that's the kind of doctor I want to be. So I took off to Japan after I finished my medical science degree from University of Toronto, and I taught English there. I wanted a break, I wanted to just travel and explore the world. And then I came back, and I applied every year when I was in Japan. I knew I was going to be a naturopathic doctor. So every year I applied, and I decided to stay in Japan for extended time, 3 years. And then I came back and I went to Toronto to the Canadian College of Naturopathic Medicine and did my 4-year degree. So then I finished and moved to the West Coast, moved to Tofino, and I practice in Tofino and Port Alberni.
That's amazing. That's where we met, at the Canadian College of Naturopathic Medicine. And my next question for you is, what does health mean to you?
Health is not just the absence of disease. So health to me is optimal, feeling your best. So it's removing the obstacles to cure. In naturopathic medicine, we talk about these obstacles. These are things that the reason people can't heal. So looking at people's stress levels, or their home life, or their sleep, or what they're eating, or medications they've been taking in the past, and looking at the whole picture and taking away those obstacles slowly, one by one. And it's a gradual process. To me, health is a lifelong journey. It always can be better. But you get to a point where you feel like you wake up in the morning and you're like happy to be alive. To me, that is health. It's not just feeling like you're not sick. It's more than that.
Oh, I love that. Happy to be alive. That's awesome. So what's the main focus for you in your practice with your patients?
I see a lot of women's health in my practice, meaning I see, hormonal imbalances, women going through menstrual problems, PMS, menopause. I also see, thyroid problems. I see fatigue in my practice. I see a lot of people worn out, burnt out, tired, anxious, insomnia. And I'm just saying women because I see more women than men, but I do treat men too. It's just that probably 70% or 80% of my clientele is women. They're just more likely to go to seek help. And it doesn't mean men don't have problems too, but that's my main focus because that's what I see most in my practice. But I do treat digestion as well. That's a huge part of the overall picture of health. And because of my own issues with digestion and fatigue and immune system issues, I feel like I can resonate with those things as well.
Awesome. And what can a patient expect when they book an appointment with you?
So the first appointment is 75 minutes. So I spend a lengthy amount of time going through your whole health history and asking you questions that maybe nobody's asked you before. And there is a lengthy intake form to fill out before you come to make sure I don't miss anything. I have patients bring in vitamins, medications they're currently taking, so I can really take a good look at what the person's putting in their body and what it might interact with anything I may prescribe. And then I come up with a follow-up plan. Usually I give the patient some things to go home with, some dietary changes, a few supplements. But what I do is I need to think sometimes about the plan and see if we need to do extra lab tests, extra testing that maybe they haven't had done with their doctor. And then during the follow-up visit, we will go over lab tests, we will go over a treatment plan, and the treatment plan is a journey. It's not like you come see me one visit, it's a series of visits, usually at least 3 or 4 visits to fully, give it time before you see results. That's what I always stress to people. With naturopathic medicine, it's not a quick pill. It's a lifelong, journey to be healthy. So it's a process. But usually I expect people to feel something in a few weeks after seeing me. I say you'll feel something is different, something is getting better. And some people have drastic, improvements in 3 weeks. So it all depends on what I'm treating. But it's at least 3 or 4 visits, I would say. And then I do other modalities. I do acupuncture. I do intravenous vitamin therapy, B12 shots. So sometimes I'll move patients into a modality where they are seeing me monthly or weekly for a certain modality just to help with their overall health, to help them feel better.
Excellent. That's something, going back to that topic of happiness that you brought up, that's something that I've always loved about you. We met almost 20 years ago, and you've always just been this really effervescent, bubbly, smiley human. So I love that you're here offering that to your patients. So happy medicine or naturopathic medicine week to you.
Thank you so much, Tanya. Thank you for joining me.
Welcome.
Happy Naturopathic Medicine Week. Bye.
Thank you.